just call us up or email us. Today, our learning objectives are quite simple, but you will see that they develop into interesting updates from Cal OSHA. So I want you to be empowered from the employer standpoint, or if you're an employee, welcome to our webinars as well. This is the Employer's Corner, the Friday Employer's Corner, where you get to ask me questions and we get to answer them or look for the answer in the Cal OSHA standards. We're in California. If you have operations outside of the state, we can also provide with that information because, as I told you, I'm an authorized trainer also in other states, and I look up the information because the regulations vary from state to state. So identify at least 2 ways of browsing the Cal OSHA website to find information that really matters to you as a safety person at your workplace. Either you're a safety director, or you're an industrial hygienist, or you're in charge of the safety program at your skilled nursing facility, or at your healthcare facility, or at your manufacturing plant, or for construction crews. This is a general overview of what is required of you, employer. And if you're an employee, trust me, you have safety responsibilities just the moment you come on board as a new employee. Okay, great. So the second one is mentioning at least 3 different tools to stay compliant with Cal OSHA updates. So once we know what the updates are and how to look for them, or how to get a grasp, an actual systematic way of getting this information to us, how are we going to make it how are we going to do it so that we become an employer who is compliant with these regulations, so that we don't have the fear of having OSHA knocking on our door and not being prepared with documentation that they will ask for. And number 3, review a list of most frequently asked questions made by employees to Cal OSHA regarding COVID-19 and lack of compliance by employers. So I'm going to highlight a couple of those questions, and I'm going to show you where to find more information. There's 2 full pages put out by Cal OSHA with all of the information regarding some labor laws and also some Cal OSHA regulations in regards to COVID-19. So those are that's a good read. So I won't get to all of the questions, but you will have the resource. So staying up to date is it should be a systematic approach. You should have a system on how to stay updated. Your company should have a system. And so just because we have some of the things going on and we're so tired of hearing the facts, the truth is in California, the cases are not decreasing. In some areas are having more incidents and more cases, more positivity rates than others, right? So right now we have more than 500,000 confirmed cases. And so we continue to test people. Almost 9 million tests have been conducted in California, right? So we've seen an increase in these testings, and of course that will increase the number of positive cases. It's expected. But it is very important to have testing in order to do contact tracing. And the getting those tests back as soon as possible is really key for those contact tracers. Or if you are doing incident investigation at your work site, this information is really, really important, right? As case numbers continue to rise in California, we have more serious outcomes for those people that have serious underlying conditions, right? So we really need to keep an eye on those that we know we must be most careful with. And at the places of employment, we have people that are over 65 with underlying or comorbidity issues such as diabetes, heart conditions, immunocompromised systems, those kinds of things. So the Cal OSHA core of the regulation is to keep a place of employment that is safe and helpful for all of those that come to work for this employer, right? For our places of employment. So there are a total of 38 counties required right now to continue their indoor operations shut down, right? So there is a document that was out on July 13th. It's an order to slow community transmission. So I'm going to take you there. Let me see. Here it is. I'm going to share it with you guys. New share. This is first, so we always go through some of the updates, some of the newer documents, then we go into our objectives. But there it is. You can see the guidance on closure of sectors in response to COVID-19. So it's mostly for places that have a lot of operations indoors. And this is because statistically and through studies, they have demonstrated that there is a higher incidence of positive rates whenever people are indoors, or they are even if they social distance, but because of the issues of several other factors such as ventilation at the workplace, there is a higher incidence of this disease being passed from one person to another. And so this is why this order came into place. And it just makes sense, right? So as of July 13, there are 29 counties that have been on the county monitoring list for 3 consecutive days, but there hasn't been any change, right? This one continues to be in effect. So it's closing on a statewide basis, consistent with the June 28th and July 1st restrictions, all dining restaurants indoor. So I love it because now I see all these restaurants taking their people to eat and dine outdoors, and they're putting like little carpets and making it look nice outdoors. Wineries, tasting rooms, movie theaters, family entertainment centers, zoos, museums. So you can read this. And I like how they go into the breweries, bars, and pubs, all of that, and they explain why. And you know what? Any operations where people come in and you have no way of knowing who comes in, for how long do they stay, and then when they leave, it's just very difficult to do contact tracing. That's why the issues with bars and breweries and wine tasting rooms. And to that, add the fact that you have the issue of alcohol in the system of people, where alcohol, blurs your judgment. And so people don't really remember how long they talked with so-and-so, or how long they were in a certain area of the establishment, and with how many people they talked, just because alcohol relaxes us and we do not have the same cognitive abilities. So it just makes a lot of sense. There's a lot of great guidance, and they told you why, the justification of all of it. Let me take you back to my PowerPoint, because what I do is I always kind of summarize what these things are about. And before I summarize that July 13 document, let's discuss a little bit of what's going on here in California, where the numbers are going really high. And that's with agricultural workers or farm workers, right? So we see that here in California, 50% of the COVID-19 deaths are amongst Latino workers, right? And so the issues here have to do a lot with the fact that there's fear, reluctance to self-report, tell your doctor, your employer, your coworkers that you're experiencing symptoms, because you don't want to be sent home and have your income go down. And that's mainly the problem with this Central Valley in California. These workers, the agricultural, the grape pickers, the plants where they pack pistachios and nuts and fruits, because we have a high number of Latino workers who are undocumented and who are afraid and refuse to test. So even if they've been in contact with someone that tested positive, they themselves may not want to test or take a test, because of the fear that the test may come back positive. So these issues, if you are one of those companies that has establishments in the Central Valley, please take all of this information into account to modify your COVID-19 programs, because you really need to discuss this and be open about it, and reinforce the fact that you are going to be taking care of these people, that there are ways of getting them sick leave and payments while they are at home. Otherwise, you're going to have the issue of the spread of this disease, because people are just very fearful and reluctant to report. So it's just kind of like an intro, because when we talk about some of the updates, we're going to see how that comes into play, right? Some of the latest documents, aside from the July 13 guidance and closure of sectors in response to COVID-19, they've been issued today because they bring these control measures outlined in those documents, and they are mandated statewide. So the reason why I put this out there is because when you have the California Department of Public Health or your local health department issue guidance or issue documents like the July 13 or the July 24th document or the August 6th on respirator shortages, you want to make sure that you implement them, you quickly implement them into your program, because OSHA will not be changing their laws to immediately put all of these changing updates and guides that the Centers for Disease Control put out, the California Department of Public Health put out. What OSHA does is they keep an eye out for what's recent, but they basically adopt it by reference. So remember that I come from the OSHA point of view. And when I say that, What I mean is, I'm trying to give you an insight of what OSHA's viewpoint is. And they always say, you know what? We are not going to reinvent the wheel. What we're going to do is we're going to use whatever all of these bodies of highly experienced people are putting together for the health and safety of the public. We're going to implement it into the workplaces. See? So they only have jurisdiction for the safety and health of your workplace, nothing outside of the workplace. But they use these documents from the California Department of Public Health or the Centers for Disease Control in order to guide how they're going to see if there's been a violation to your policies, to your procedures, or to any of the safety and health codes or standards issued before, right? So, and that's why I highlighted in red, they must be adhered to, because the July 13 is an order that is still in place, and you must follow it if that's the type of industry you're in. And then you may think, well, OSHA is not really going to look into those things because this is the California Department of Public Health, or this is just my local health department. Well, you have all of those agencies coming into place, right? Other operations can be conducted. If you have indoor operations that you're taking outdoor, you just have to take into account the weather. You cannot expose people to heat illness. You have to make sure they are sheltered. And as long as no more than one side is closed, allowing outdoor ventilation, that's what is in the July 13 guidance. Last week, we talked about the California Department of Public Health, July 24th, employer playbook for safe reopening. And so I highlighted this 1, 2, 3, 4, 5, 6, 7, 8 points, right? And through them, we went one by one. Right now, I just kind of gave them back to you. But one of the things that I wanted to highlight again is having an infection coordinator, a person in charge of this plan. And he is the name on the checklist, the name on your COVID-19 program. And what happens is many times that same person is you, the safety coordinator, the person in charge of the safety program of your company. And you feel overwhelmed. You feel that it's too much on your plate. So remember that you can delegate parts of what you find out it's new or it's coming into play and that you need to implement. And you can delegate it to other responsible persons depending on their department and what they're doing and what you have delegated to them in the past. So that way you don't feel overwhelmed by all of these things, right? So right there is the document again, the employer playbook for safe reopening. And we discussed it last week, so I'm not going to go into detail for all of these steps, but please do review that document. For the Cal OSHA website, so when you go to the website, you're going to find a lot of information. The federal website has a safety and health dedicated website for all of the information regarding safety and health in the workplace. In California, we have a website that is for labor in general. So it has a lot of tabs, and only one of those tabs is the California website. The reason why I want you to become very familiar with the Cal OSHA website is because that's how you're going to stay updated. So the first thing we're going to do is we're going to take you to the actual website, the Cal OSHA website to see. Let me see. Well, right now I have it right here but I want to see. Hold on. I gotta move this bar. It always happens. Can everybody see my my screen? The internet. Yes. Okay. Cal OSHA is one tab. Do you see how labor law is another tab, and then Cal OSHA is another tab? Workers' comp is a different tab. Self-insurance, apprenticeship, directors of. Okay. So whenever you're looking at the Cal OSHA information or to update your company in regards to Cal OSHA standards, you have to be in the right tab. You got to make sure that you're looking at the right set of information under this tab. So you got consultation, enforcement fields, etc., right? But what's interesting about this, if you go to the homepage of the Cal OSHA website, is you have great information here to keep you updated. So one of my first things for you to do is that same person that you put on per the July 24th guidance playbook, employer playbook, that says, you know, you must have a COVID-19 program in place with one person in charge of it. That person should delegate this task, or maybe she should be. I recommend he or she should be the person that every day on a daily basis checks the website, the Cal OSHA website, the California Department of Public Health website, your local health department website, and any other websites that are pertinent to you, like the CDC. But many times you just kind of, by clicking onto the Cal OSHA and your California Department of Public Health, you're going to arrive to a lot of the Centers for Disease Control information. If you go directly to checking the CDC, the Centers for Disease Control website, you're going to find yourself overwhelmed and clicking, going down the rabbit hole and just spending a lot of time. So my advice to you is start with what applies to your jurisdiction, Cal OSHA and your local health department, right? And then your California Department of Public Health, because they're the ones putting out the information that is most updated for you to stay in compliance with the COVID-19 updates. So you have here at the very top the Cal OSHA safety guidance on coronavirus, right there and then. So this right side of your screen has a lot of great information, and it starts with the coronavirus. We have been lately very distracted by the news, and we know what are the most prominent issues right now blasted to us in the news. So I urge you, if you are the safety director at your company, to, yes, continue to pay attention to that, but do not forget the other issues that continue to represent safety and health issues at your workplace that may be right now being overlooked because we're so focused on COVID-19 and other issues that relate to the social, political, and urgency of other matters because of what's happening in our country. So I really urge you to come to the website, look at the right-hand side, say, okay, for anything that I have to look up in regards to coronavirus, I just click there. And when you click there, you're going to get this very long page, because it goes by industry, of information. But I like that at the very top, they put the updates. And I'm going to talk about this update today a little bit more because I have it all in my slides. But see, that's how you get to the safety guidance on coronavirus. The worker safety and health wildfire regions, only if you have outdoor workers, you want to look at that, because if you're sending crews to work outdoors where there's wildfires, you need to look at the air quality wherever they're working at. So, you know, it's interesting how Cal OSHA puts up there some of the very important information, because they know that people click on everything that is most visual. So those two are important for Cal OSHA. It tells you what they're thinking, where they're coming from, right? Right here, it tells you that Cal OSHA really is one of the states with the most inspections. So compared to the rest of the country, Cal OSHA sends out more inspectors to go to the workplaces to see where are the violations. That's why it's so important to be ready. And that's why this Employer Safety Corner Friday, 1 hour, I intend to give you the information that you need to have to continue to stay updated and compliant, right? Listen to this. Cal OSHA conducted the most inspections in the nation, with 7,571 inspections, exceeding the goal of 7,540. And that's for the fiscal year of 2019, right? So they cited almost 20,000 hazards and created safer working conditions for at least 8.4 million employees. Enforcement and outreach activities contributed to 2018 fatality rate lower than the national rate. So they show you their efforts. They show you that California really is leading the way for worker safety. And then they give you their focus. So workers, facts for California workers, protecting temporary. This, please look at it if you have temp workers, because they're yours, especially if you supervise. Temporary workers, any workers that are sent to you through your temp agency, whenever they're at your facility and you supervise them, they're yours. They're yours in regards to safety. Anything goes wrong, they get hurt, they get COVID, they're yours. It's going to go on your log. So that's super important. It's going to go on your log. Do you realize your OSHA log? For those of you that know what I'm talking about, some employers in California are required to report and record on certain forms for California, and keep them and then submit them electronically. Temporary workers from a temp agency, if they get hurt or get COVID at work and it's determined it is work related, it's going to go on your log because you supervise them. If it's a crew that comes with their own supervisor, it doesn't go on your log, right? And so that's important information, you guys, that they put up here for you. How to report a workplace accident. This is where you just click here whenever you have to report something, and it gives you, you know, if 92656, let's see, that's my zip code. That tells me my district office. That's how you find your district. Why is this important information? Because whenever you have a serious injury or illness and you need to pick up the phone and call Cal OSHA, this is how you get their information really quick to your fingertips. So I would have to call this 714 number because that's the enforcement district office that would receive a phone call from me if I had a death or a serious injury or illness at my workplace. And remember, COVID-19 could be a serious injury or illness because people get hospitalized, especially if they have complications, right? There's very important information here on this homepage. You can't overlook it. Then they have feature safety programs and great information regarding these types of industries. So make sure you take a look at, whenever you click on coronavirus information, it's going to take you to the same place as if you clicked at the very top. So safety programs, you know, if you need to look at any of this, valley fever information, respirable crystalline silica, look at this part. And then other resources, and make sure you know about their policies and procedures. Policies and procedures are key. So I'm just kind of showing you from an employer point of view, at the homepage for Cal OSHA, what is important to stay updated and why certain things on this homepage are super key and important to you, employer. If you go to the policies and procedures right here that I'm going to click, it's going to give you a little bit of information as to how Cal OSHA conducts their inspections and what they are looking for. To me, that's gold. I really find that to be the gold nugget because it does tell me if they show up knocking on my door, I got to be ready. And how am I going to be ready? By doing this. The page isn't changing. Guys, are you seeing what I'm looking at when I click policies and procedures for Cal OSHA? Because when it says the page, I want to make sure that you guys see it.
It looks like it's the web page, not the PowerPoint.
Yes, I'm still on the web page,
Okay.
and I'm going to click on policies and procedures, okay? So when I go to policies and procedures, can you see now how I went to Cal OSHA policies and procedures?
No.
It says operating rules for industrial trucks.
Are you kidding me? Oh, man. How is this not happening?
You might have to share your desktop in that case because it looks like you're probably just sharing that page.
Okay, we see Cal OSHA policy and procedures.
So this is the home page. Can you see the home page?
Yes, Department
Okay.
of Industrial. Yeah.
Top corner, guidance on coronavirus. Well, worker safety and health wildfire regions. And you're thinking, why is this together? Because they're paying attention on both. And that's what I was explaining. This is very important to them, the COVID-19. And also whenever there's fires, they keep an eye out for anybody, not just firefighters, but also any work that takes place outdoors that exposes workers to smoke and wildfire hazards. Does that make sense now, what I was talking about? I didn't know you weren't looking at that. I guess I was just sharing my Safari internet, but I wasn't really sharing the actual web page. I'm really sorry, you guys. Then I told you about what California leads the nations on worker safety. And then I told you that they really have some featured safety programs that goes from cannabis, coronavirus, Ebola virus, heat illness, respirable crystals, a lot of great information here. But then I took you down and I wanted to tell you that for employers, it's very important to have kind of like a hint as to what Cal OSHA does when they go out there to inspect. Since they are at the top in the nation as the department that performs the most inspections, I want to tell you, what do they look at and how is it that they will cite you, or how do they see something as a safety violation? So you must click on policies and procedures for Cal OSHA enforcement. If you've never done that, do it. It's great. Can everybody see that? Cal OSHA policy and procedure manual?
Yes, we see it.
Great. The Cal OSHA, okay, thank you for telling me that you guys weren't seeing that, okay? The operating rules for industrial trucks, I actually sent it to one of my clients because they were updated, the operating rules for industrial trucks. So for those of you that have forklifts, you have to have the newer one. It's not super new, but I think it's a year old. So if you have the one that is been issued a long time ago, you need to update it to the newest version. And see, this is information that is on the updates for Cal OSHA. And so she didn't know there was a new set of rules that needs to be kept where your forklifts are at. There is one new one. So that's what I sent to her, and that's what you were seeing. So I apologize for that. The policies and procedures is dissected this way, and it's really great because look at all this information. This is what Cal OSHA inspectors will follow. Documenting the existence of a violation. It's a policy and procedures manual, is like the behind the scenes. This is what they come to your place of employment with. This is how they look at the violations, right? Establish and document employee exposure. So this part of the document will tell you whether or not they feel there was a violation of safety and the employee was exposed. It'll tell you establish and document an employer-employee relationship. They're going to talk about temporary agency employees. Identify the regulation that was violated. Sometimes they make mistakes as to citing the actual violation. Rule out the Independent Employee Act, affirmative defense. Sometimes you get cited on, let's say, for example, your employee complained that you are not really providing face masks and that you're not paying for those. And they complain about something related to COVID-19. And then you can actually, through the Independent Employee Act, go about analyzing this 5 criteria to tell Cal OSHA that you indeed were doing everything it takes to keep people safe, but that the employee was actually violating safety protocol. And so if you can prove that you have a safety program that is effective, that you have disciplinary issues going on, and that you have training that is being provided to those employees so that everybody stays safe, but that employee independently chose not to follow your safety rules, you can actually get out of being cited. And that's great because it saves you money and it makes you look really good if you're the one fighting those violations, right? So that's why I wanted to bring this up to the table, to show you guys how sometimes in the homepage we see so much information that we don't get into, but policies and procedures is one of those that you do want to visit. I'm going to go back to my PowerPoint so that I'm giving you how to keep updated, how to see the OSHA website in a way that helps you even more so to stay updated, especially during these COVID-19 times, right? So I visited the homepage. Are you all seeing my PowerPoint? Oh, stop sharing. Are you all seeing my PowerPoint? Yes?
Yes.
Okay, great. So the next thing is, hold on. Okay. Check the news releases. Is anybody already receiving emails from Cal OSHA? Anybody receiving emails from Cal OSHA? Okay, great. So if you're receiving emails from Cal OSHA, that is going to help you stay updated. So you get them from the Department of Industrial Relations. It'll tell you, it depends on what you choose. That's the information they send you. They don't blast you with information that you don't want. So I'm going to click on this link that I gave you, and I'm going to show you why that is super important. When you go to the releases, August 5th, Labor Commissioner's Office files lawsuits against Uber and Lyft for engaging in systemic wage theft. So you can see all of these news releases are related to labor laws and safety laws. But you want to make sure that you go ahead and get emails from them, right? So in order to get emails from them, I'm going to give you a link to get emails. I put it in one of my links. OSHA International, let's see, it's in the next one, I think. Did I? I did not put it there. Okay, I'll take you to that in a moment. But it's important that you get emails. Also, Federal OSHA sends quick takes. The quick takes are bi-monthly information on what's updated from OSHA, right? So either you check it out or you subscribe. Subscribing to these quick takes from Federal OSHA or Cal OSHA is a very good idea if you do have time to go over your emails on a consistent basis. If not, just by assigning a person that every day does a daily check of the following websites, that's what you want to do. So you want to make sure you check the Cal OSHA website, you check the California Department of Public Health, and you also check the covid19.ca.gov sites, right? You also want to check your local health department. That workplace infection coordinator is the same person that does the daily checks. And then that person gets support from responsible persons. Like what? Let's say, for example, you discover there is a new document, which I'm going to discuss next. There's a new document regarding respirator shortages. you should have a person in your facility that is in charge of the respiratory program, right? Because there's a whole Cal OSHA rule regarding how to have medical examinations, how to do the fit testing on initial assignation of respirators, and then how to do annual fit testing, right? Training, etc. So you have that person in charge of that program. Go ahead and delegate the update in regards to the respirators to that person, right? And so for any updates that you get from the Cal OSHA, like that, for example, you saw the forklift operator rules, and that was out probably last year. Whenever you got that, you go ahead and give it to your warehouse manager, and you have him or her in charge of making sure that it gets to all of the forklift operators. So don't get overwhelmed by all of these updates. You have people that support you in your safety program. If you don't have this support system, then we're doing it all wrong. You should go back to your injury and illness prevention program and see that number one element of your IIPP. Remember, IIPP is Injury and Illness Prevention Program. And the first element of that document says responsibility. And the responsibility means who is in charge of safety here? And you say, well, you know, HR department. Okay, if that's the one person, who is supporting that person? And now you designate teams of people that help this HR person, who is also / safety director. Many times you get to wear all those many hats. You have a support team out there in the field. And so you have the operations manager now becomes the support system to the HR person. So either you have an independent safety department where you have a safety director. So the bigger the company, the more you will have an EHS person, environmental health and safety director, who is permanently there and who will actually delegate and have teams of people that help for safety purposes. But if you don't, because you're a smaller company and you're the HR person and you're the safety director as well, make sure you have a support system through your operations manager, the installation managers, the crew, the lead, the foreman, whoever they are. They need to know that as part of their job descriptions, the safety portion of it applies to them, and train them in how to train other people. Some of them have never trained other workers, and so they need some instruction on how to do that. Okay, so get support so you have a good system going, right? Let me see. Okay, there it is, the email list. So I did have this link. I knew I had it, because doesn't it happen to you that every time you want to get somewhere in the websites, whenever you're doing a class, you can't get there? Now, can everybody see the get email notices from Cal OSHA? Okay,
Yes.
you subscribe to this list. Take a look at this. It says DIR news releases, the Department of Industrial Relations news releases. So you check mark whatever you want to get. If you are a workers' compensation person, you want to stay on top of that, you would check that as well. In this case, if you only leave it as DIR news releases, you'll get the safety stuff that you are interested in. And at the very bottom, other notices, DIR COVID-19 guidance. Please check that one. The Cal OSHA workplace safety and health updates, because if you leave it as DIR news releases, you're going to get the labor department as well. So if you don't want to do that one, just focus on the safety ones. Cal OSHA workplace safety and health updates, COVID-19. And those are the two ones that I recommend for safety. If you do that, you're going to get these emails. They're very helpful. They even give you dates as to when they're planning to send out enforcement. You know, we're sending enforcement out in the field to check on agricultural or on construction workers or healthcare. They'll tell you, let you know, like, for example, whenever they put in place the emphasis program regarding ergonomics for healthcare, they send you a notice. So please subscribe. That's super, super important. It's a way to keep updated and to stay up to date with everything that California has to offer, or this website has to offer. Complying with the updates. So once you have this updating down pat, you have one person that every day during COVID-19, I really recommend you do it on a daily basis. If you're in healthcare, I recommend you do it on a daily basis, so that the safety coordinator at your workplace gets to their computer, and the first thing they do is they check the California Department of Public Health site, right? If you're in healthcare. So now add to that the Cal OSHA site, because that's just part of what you do. Before the COVID-19 outbreak, if you were not in healthcare, I would really recommend that you have a person check the Cal OSHA website once a week. But in healthcare, absolutely every day for the California Department of Public Health notices. But just subscribe. They also have a subscription where they send you daily notices of what's going on. I mean, I got 2 days ago, I got a notice on foodborne illnesses, and they were telling me about Thompson onions, all sorts of onions, yellow onions and sweet onions and white onions causing salmonella infections. And so it's information that as healthcare providers, you need to have every day updated, right? So one of the August 6th, this is one of the newest documents that OSHA sent out. And this is why, for safety related purposes, if we're talking about COVID-19 updates, this is why I gave you that order. You first check OSHA, California Department of Public Health, then your local health department, because then you're gonna marry them all and see if there's any discrepancies, which I doubt, because they all always link to each other. You put always the one that is the most stringent or the most strict, right? And so one of the updates in the OSHA website is the August 6th changes or key points for respiratory shortages. And it was an interesting document for me to read because it applies only to healthcare and those companies that have to already comply with 5199, which is the airborne transmissible disease, right? So it's all healthcare, emergency responders, nursing facilities, skilled nursing facilities. We're talking about homeless shelters, that kind of thing, right? It replaces the previous guidance of June 12, 2020. So if you had this person in charge of your program checking for these updates daily, they would get to this document the same day as I did, the day it came out, right? Because they're daily checking the website. Let me show you where this document is at in the website. I'm sorry about, hold on. I'm gonna share that. So I'm sharing again, my screen here. If I go to the home page of OSHA and I go to the top OSHA safety guidance on coronavirus, there is in red, they always highlight your updates. OSHA interim guidance on COVID-19 for healthcare facilities, severe respirator shortages. And I have to read through the whole document. And then I highlighted the most important issues on my slides, which is where I'm at right now. Let's see. So replaces the guidance from June 12th. It prioritized the respirators for high hazard procedures and some other optimization strategies, but it tells you which ones are not currently necessary, and it goes through which ones. California healthcare is no longer experiencing an extreme respirator shortage. So they tell you which optimization strategies are okay and which ones are not. Like, for example, before we were able to use respiratory protection that was not made here. When it was like a severe shortage, we were okay to get them from whenever we could get our hands on, as long as it was a air purifying filtering piece, right? Not the case anymore. We have enough, and so this is what this document is saying. So we continue to say we want to reduce the use and destruction of respirators during the fit testing process. And we want to provide and ensure all employees exposed to aerosol generating procedures. What are those? Like intubation procedures, right? That generate misting or smaller particles, like when you're doing spirometry and you're testing for lung capacity, right? Then you're releasing these aerosols because you're producing coughing. The patient is given some medication to make sure that you get a sample. And so that is what is called an aerosol generating procedure. And so it talks to you about, make sure that for this type of procedures, you give them a PAP or something of equivalent protection, right? But it says, if you don't have PAPers because they're expensive and maybe you haven't been able to do training to all of the people that need to be trained, because using PAPers requires that you teach them about, the battery life and how to clean and disinfect them and all the parts of the PAPer, because they got to put a hose to the face piece and the cartridges and everything else that goes with it. But if you don't have it, at least, and it says this, if PAPers are unavailable and cannot be obtained, an N95 respirator is the minimum protection that should be used. Right? So now this is a OSHA document. So they're going to hold you to this one, right? It's not from the California Department of Public Health. It ties with their guidance, but this is Cal OSHA. If you go to the CDC, you'll have a lot more information in regards to respirator shortages. But if you are working in California, this is what applies. And that's why going to the Cal OSHA website first to check for any updates really matters. Then you can go to the rest of the guidance, etc. Because Cal OSHA and your local health department both are going to cite you, right? They're going to fine you if you don't do what they want, what they are requiring of you. So subject to change, so they're telling you this is not a document that will not evolve. This document will evolve. And so now, right now, they're saying only NIOSH certified respirators should be out there for healthcare workers to use. Only NIOSH certified. And reusable, preferred over disposable, because that way you can clean and disinfect them, right? Half mask, elastomeric pieces, full face pieces, because they fit better and you can actually clean and disinfect them. There might be other public health regulations regarding respirator with exhalation valves. We were talking about exhalation valves probably in week 2 or 3 of this whole COVID-19 pandemic. And we were talking about how exhalation valves, because they release that breath out into the environment, that they were not allowed for healthcare workers. Now, this document tells you Cal OSHA is not going to get into the enforcement of that. So if you have an internal policy that says that you do not allow respirators with exhalation valves, then that's up to you. Right now, Cal OSHA says, I'm not going to get into that because there's not sufficient evidence right now in the scientific community. There's no documents where I can say, you know, exhalation valves really do contribute to the transmission of COVID-19. So Cal OSHA not going to enforce it. You do your own research and you see what you want to do, whether or not you want to use exhalation valves, respirators with exhalation valves. Industrial NIOSH certified, allowed in healthcare settings. FDA regulates respirators used in healthcare settings. So manufacturers of respirators have this NIOSH approved line of respirators that they sell you, right? But for healthcare, this NIOSH approved respirator also have to be FDA approved for healthcare only, right? Right now, what this August 6th document is saying, we are still allowing you to use industrial NIOSH certified respirators that may not be FDA approved. You can still use them for healthcare during this COVID-19 pandemic. And do you see how important it is to really go slowly and dissect this? So you could do it in conjunction with that person that's in charge of your respiratory protection program and say, this is what we're going to do. This is how we're going to do our modifications to our program right now, which are interim, right? Just while this pandemic is still going on. So, and remember, it's because industrial NIOSH certified respirators are used in construction to prevent exposure to asbestos. So they're geared towards other types of particles. When we talk about biological hazards such as COVID-19, we only use FDA approved respirators. NIOSH certified, FDA approved for healthcare use, right? That's what we've been doing prior to the pandemic. During the pandemic, Cal OSHA is saying we are okay to continue to use industrial NIOSH certified, even if they have not been FDA approved. Employee provided PPE, that's an issue that is a little bit interesting. I don't recommend that employers allow PPE being brought by employees. But when there's shortages and employees have access to PPE that they can bring, as long as it complies with your own policies, your internal rules, you know, all the same safety checks that Cal OSHA requires, for example, cleaning and decontaminations and appropriate storage of PPE, such as if they have a PAPR, an elastomeric, or a half mask, any of those types of personal protective equipment, that they follow the exact same rules as if the PPE was provided by you, the company. So they still allow that. They continue to say, you know what, if you're gonna assign a person to use a respirator for patient contact, you must fit test that person for initial use. And now they changed it to where it's now not up in the air where they say, well, you know, we're gonna suspend annual testing, because federal OSHA issued a guidance in that regard saying we're not gonna enforce right now the annual fit testing issue because we're in a pandemic and we have shortages. Well, now Cal OSHA healthcare, Cal OSHA here in California is saying, you know what, Cal OSHA will allow a 90-day delay for meeting annual fit testing requirements. So now they're just given a 90-day delay. See, this is why it's important. You can use these two sections, the 5144 Appendix A, to help conserve respirator supplies, and employers may also use modified quantitative fit testing methods in accordance with, which basically is the same. I was taking a look at both regulations. They're pretty much the same. And that goes into telling you, let me take you there, because we're in California, might as well just take a look at it, right? So what does the regulation say in regards to respirators? Fit testing procedures, and it goes into qualitative and quantitative, right? Quantitative uses a machine and it destroys the respirator, makes a hole through it in order to actually do the fit testing. And qualitative is through a hood where a person is required to detect the smell. It could be banana oil, etc. And so it goes into the accepted fit test protocol. So it's right there on your link. And things caught my attention, such as the assessment of comfort. How much time are we really taking to assess the comfort? And it includes a review of the following points with the test subject. That means the person who's going to be wearing this respirator, right? So you're going to allow the person adequate time to determine that it is comfortable, that the position of the mask on the nose is good, that there is room for eye protection so that it doesn't ride up and it doesn't allow for the safety goggles or the safety glasses, that there's room to talk, that the position of the mask on the face and the cheeks is good enough to get it. So you're going to assess for comfort, and then you're going to fit test them, right? So these are the procedures. I really love them. I don't remember what week that we were doing PPE or maybe respiratory protection. I mentioned that in healthcare, the studies show that there is very little training being done, and that on average, a healthcare worker will spend only 15 minutes in training in regards to how to don and doff a respirator. That's very little time, you guys. Very little time. And I know we're overwhelmed. And even if you're not in healthcare and you have a respiratory protection program in place, you must spend enough time. 15 minutes is not enough to explain to someone how to properly clean and disinfect the respirators, right? So that's just to highlight some of the issues where we as employers may not be compliant at this point. A couple of more things is the extended use of these respirators. So if you're cohorting patients with the same virus, if you know that there's this is the whole COVID-19 ward, then it's the same pathogen, and so you can extend the use of your respirator for 8 to 12 hours. So that's also in this August 6th document. Disinfection, it says ethylene oxide cannot be used. Ethylene oxide is commonly used to disinfect, clean and disinfect, sterilize actually medical products. But here what they do is they give you an actually FDA link to decontamination and what has been authorized as processes to have respirators out there in the field that can be reused. And so there's a whole list in this link. It's not in there. Hold on. Safe for clean? No. In this link, when you copy it and take it to your browser, it'll take you to different methods that are already out there that are allowed by OSHA. So it might take you to Michigan State University and how they're doing disinfection of respirators for reuse. And it'll tell you, for example, that in the process that they are using, you can only use maximum 3 times the same mask being disinfected 3 times and no more than 3 times. So it gives you good guide as to what OSHA is considered to be a good disinfection procedure for masks that you're going to be reusing, all right? And I gave you the link there. Safe for cleaning and disinfecting, a link to that too, because we want to make sure that we provide workers with the best chemicals that are not gonna start causing asthma and some sensitization or things of this nature, right? So I gave you that link as well. Frequently asked questions. So we get into what is frequently asked from workers. And one of the main questions is, for example, what safety and health precautions must my employer provide workers in response to COVID-19? So there are 32 industries, and OSHA is putting out there this information and saying, hey, we have actual guidance for 32 different industries. So what this is telling you, once Cal OSHA puts this on their site, what this tells you is they're going to follow that and say, are you following your industry's guidance? So review it, go to the covid19.ca.gov. covid19.ca.gov has the guidance per industry and the checklist per industry. And one of the recommendations I have been making from many weeks ago until now is, because there's the guidance for the type of industry and then is the checklist for your type of industry. Take that checklist and post it on your bulletin board next to your OSHA posters and the stuff that you have at your places of employment that everybody needs to see. That gives reassurance to everyone that you're doing something for COVID-19 prevention. And the name of the person in charge of the program should be posted, right? Because the first thing on that checklist is name of the person responsible for this program, right? Each employer must implement a plan that is specific to its work site. You cannot just download a guide and then say, well, this is my COVID-19 program. You actually have to go point by point and say, okay, so how are we doing social distancing? Are we providing with actual marks on the floor, or are we putting our stations separate enough and then we're putting a barrier, physical barrier? What are we doing? And we write it down, right? So very specific to your workplace. Another one, and these are good questions that employees are asking. For example, I was diagnosed with COVID-19 and I have been using my own sick leave while I have been unable to work under Executive Order N6220, which is what says that you have the right to workers' compensation benefits. If my illness is deemed related to my work, is my employer required to give me sick leave back? So for those of you in the human resources department, you already know that the answer is no, right? Because it, of course, depends upon the type of sick leave, but the actual order says that they must use their sick leave first and then get into temporary disability workers' compensation benefits. So if your employer is providing you paid sick leave specifically available in response to COVID-19, such as the Families First Corona Response Act, then you must use that leave before you receive temporary disability benefits. Must my employer bar workers from coming to the workplace if they appear to have symptoms or say they have been exposed to COVID-19? The answer is very simple. The answer is yes. And then I go back to what I show you in the beginning with the farm workers and the agricultural workers. A lot of them are working out there in the field, coughing, sneezing with symptoms, but they don't say anything because they're friends, because they don't want their friends to be kicked out of the workplace, because they're afraid they're going to lose their job, because they're undocumented, because they have to bring food to the table, right? And so the answer is yes. Someone is experiencing symptoms or they have been exposed to someone with COVID-19 and you send them home. You do not allow them to continue to work. And that should be a strict policy. There shouldn't be any wiggle room there, because then you have the issues like what you have in Central Valley right now, where we're having a surge in cases because of grape pickers or people, farm workers who are afraid of self-report and they show up even if they are sick, or if they have a child who is sick, they show up at work because they don't want to not have the money to provide for their families, right? Because these individuals may have had close, sustained contact with a COVID-19 positive or diagnosed individual. So let's say they have someone at home who's sick, right? They may be subject to a formal local quarantine order based on the health orders implemented in your county. So always check with your health department. I have said that the phone number for your local health department needs to be right there. First thing on your COVID-19 programs. And what I do for my clients when I provide you with a safety binder is you have a page right there that just a red 800 number for your local health department, so that you have access to those numbers right away. So your local health department number should be top of your list, and your local district office for OSHA, so that you can ask questions or that you can report a case in case it is work-related and they have had complications and they have been hospitalized. And remember that serious injury or illness under Cal OSHA regulations is someone who has had either permanent disfigurement or who go to the hospital for something more than just under observation, but they become hospitalized, inpatient hospitalization for more than 24 hours. Let me see if I have any more questions here. Must my employer bar workers? Yes, I did that. And then you have the California Department of Public Health employer guidelines for addressing a workplace outbreak, so that you have additional guidance that employers should follow. I also gave you a link as to what to do, right? So that you know how much time you should let pass if you have somebody that started getting sick while at work, at least 24 hours to enter that area if it's a enclosed area. But if it's outdoors, well, it's not a problem, right? But you should send that person home immediately. You should be doing self-checks, etc., for people, temperature checks. And that brings me to this next question. Is my employer required to pay me if my employer requires that I perform medical checks like a temperature check at home? And that's an interesting question, because they may say, well, my employer is saying that I need to, before I come to work, I need to take my own temperature and I need to do a self-check, and I need to take it on an app that they put on our phone. And this app, ask all the questions about the symptoms. And I have to make sure I log on every day and answer these questions. Okay. If it's through an app on a phone, they're paying for that time, right? And so it could be extra 15-minute pay added to whatever you're doing at work. But if it's not controlled by the employer, there's no app involved, and they're just casually asking you to take, not casually, they put it on the policy, but they can't control whether or not you're doing it at home, is not paid time. So that was an interesting question for me, and right there is the answer on your screen. So did I give you at least 2 ways of browsing the Cal OSHA website for newest information? Remember, you go to the home page, make sure you're on the tab for Cal OSHA, and the right upper corner will always tell you what's first thing in their minds, meaning Cal OSHA's important issues, right? And right there, right now, we have 2. We have the COVID-19 and we have wildfire. It's right there. Then you move it to the middle of the page, and you have some of the safety featured programs. And that's where you have the valley fever, the coronavirus, the cannabis industry, tree worker industry in the middle. So it also tells you those are featured safety programs. They give you more info. They want to provide with a lot of tools for your workers to stay safe. And then at the bottom, you have the policies and procedures. Policies and procedures are very important because it's like a looking behind the scenes type of thing. And so you'll look behind the scenes as to what they're looking for. And I showed you today how these policies and procedures tell you, are you really exposing your employees? How do they know that you really have this employer-employee relationship? And then that Independent Employee Act in your defense, in case someone is claiming that you're not doing something, being COVID-19 or other safety issue, and they claim that you're not doing something, they complain to OSHA, OSHA gets to your workplace, and then you have to answer. Use that Independent Employee Act as part of your defense. It's a 5-point criteria for you to say, we have everything in place. It's the employee who's not following the rules. And that happens sometimes. So we put all of these programs, safety programs in place, and then we have employees that are not compliant. Either because we are having problems with them because of their attitude, they're having problems at home. It has to do with a lot of factors where the behaviors are not there. They're not safe behaviors. So we must discipline. So you have to prove disciplinary issues. That's one of the criteria, right? So those are at least 2 ways of browsing the Cal OSHA website as part of staying updated regarding COVID-19. Number 2, mention 3 different tools. So in order to stay compliant, you must have a person designated. That's your first tool. 1 person is designated to do these daily checks. And what do we check for? We check the Cal OSHA website. We check the California Department of Public Health and your local health department, right? And these things link to the Centers for Disease Control. If you start by going at the Centers for Disease Control website, you're going to be lost in a sea of information. And then 3, review a list of most frequently asked questions. So there's the most frequently asked questions, but I also gave you the link to this. I have here, for example, for the Executive Order N6220, if you go there and I share that with you, it's a lot of FAQs right there. So what does the Executive Order N6220 do? What are the requirements for qualifying for this presumption? Executive Order, etc. So you have a lot of good questions there that you can review in your own time. And then to review the rest of the questions, you go to the link that I also gave you on one of the previous slide, which is right here at the top. And then you can see a lot of these questions. I just took the ones that I felt were most important. But here, for example, says, what additional steps must my employer take to protect me and my coworkers if someone working at the worksite tests positive? I've gone through this question in the past. I took you through the CDC steps on how to do this, and that's why I didn't put it on my slides. I just took other ones that seemed important to me, like, should they pay me if I do checks, taking my temperature and self-check at home? Should they pay me? And so we went through some of those questions. Any other questions that you may have at this point, I'm open to them. I'll stay with you chatting if you need me to, but I hope you all have a great weekend. Thank you for taking the time, and give us your input every time we send out those surveys so that we can improve these 1-hour webinars and so we can give you the information that you need. Thank you so much and enjoy your weekend. Stay safe.
Thank you, Alba. We will be sending out the PowerPoint slides after this later today. It's just hard for Alba to send them over before the webinar because there's a lot of last minute changes. So we'll be sending that out after this webinar.
Any questions, anybody? You guys are okay? Okay, very good. So don't forget to check those documents, and especially the frequently asked questions.
Thank you, everyone.
Thank you, everyone.
Have a fantastic weekend, and thank you again. Thank you, Lindsay. Thank you, Annie.
Thank you. We'll see you guys next week.
See you soon. All right.
Okay.
Bye.